Now we're moving to the next, really, I think, big transition, and that is integration, where from the silo of being separate and unequal, both mental health and addictions are part of the bigger healthcare world, and organizations are expected to be part of that world. And so we now need to be very careful because these organizations really are caring for 10 million very fragile, very ill, and costly people who are both socially and clinically vulnerable. They have serious psychiatric illnesses, addictions, physical conditions, but again, as I said, they live in poverty and so have issues of housing and trauma and violence that is perpetrated against them. And so those people have been hidden away for a long time. And probably some of you in this room who are involved in, big hospitals or law firms really didn't give that much thought to these independent agencies that were existing and exist in your community serving these people. But there is much more public awareness now. And people really are telling their story. When I was a little girl and you had cancer, people whispered about it. They did not talk openly about it, and now we all wear pink ribbons. That has begun to happen now with mental illness and addictions. And so it is, again, the best of times because of that. But nevertheless, we still have low penetration in terms of the need. 40% of people who need treatment don't get it, and when you look at addictions, probably 80 to 90% of people who need treatment don't get it. So we still have a lot of work to do, and we still count on those community agencies. And they are dealing with lots of things. So until very recently, in fact, we really knew but didn't think we could do much about the fact that someone who developed serious mental illness wouldn't get the services they really needed until about 7 years into their illness. Because of the way our system is designed, they wound up in emergency rooms or with their primary care physician, and they didn't get known until they were quite disabled. We now know we can intervene at the first psychiatric episode and really make a difference. And I'm sure the panel will be referring to some of those efforts right here in Connecticut. The other thing is that mental illness is still the most common reason for going on Social Security disability. So we have a lot of work to do. And in fact, we have a suicide in this country every 16 minutes. And of the 10 most serious illnesses, 9 of them have been reduced in terms of mortality over the last 10 years. The only thing that continues to go up is the suicide rate in this country. And for people between 15 and 34, suicide is the killer other than unintended accidents. So it is still a very serious issue that we need to pay attention to. And the very organizations that think about this and deal with this have a set of complications. They embrace the idea of integration, but they have really always been managed. Their costs have always been kept under control. And when you look at that chart about healthcare costs and how they were rising for many years, there is an exception to that, and that is care for the most seriously mentally ill and people with addictions. So when we're trying to ratchet down costs, when you're ratcheting down the costs for organizations treating people with serious mental illnesses, you're ratcheting down costs in organizations that don't really have margins. And again, that leaves them in a fragile state and can have people wind up like Timothy did rather than the way Shirley and Gabriel did. The other issue is that those community organizations provide both medical services, psychiatric services, and really social services. And because of the expansion of insurance, many states have really withdrawn their own state money. They say everybody has insurance now. What do you need general fund money? And in Michigan, where I'll be in 2 weeks and where Timothy lived and died, there was actually a crisis around that because they took all the money out of the system, and just now the expansion is taking hold. And so organizations are literally going out of business as a result of that. So they're learning to talk with healthcare, with players, and it's a different language, and with different kind of staff, and that's a stretch, and a skill set people are learning. And they're streamlining operations. One of the things Kim has done brilliantly, and actually Tyler, who's her COO, is helping other organizations, is doing things like same-day access. So if you're part of healthcare, and a primary care doc or a surgeon has someone who needs treatment today, they need to be able to send them, and they need to be able to get into care. And for these community organizations, that's a shift. So they're moving away from wait lists. It's not 6 weeks to see somebody, but they're really there when people need them today. I think the other thing we're beginning to see is they understand that they have to negotiate rates. That's also a new thing. It used to be a fixed amount of money you got. Now you need a big backroom operation. You've got 80 different insurance companies you're dealing with. Those are very sophisticated challenges. And with their slim margins, they're unable to make the kind of improvements you need to make, including electronic health records and health information technology. You know that we've got to be texting patients now, right? Just like my dentist. Just text me, I have an appointment next Monday. That's the new world. There are monitors in home that will actually do mental status checks with patients, and you'll only have to deploy a real human being if that data doesn't look good. So we have a world of technology that we have to be able to take advantage of, and I hope some of our panelists will talk about that. We certainly are seeing mergers, and every week we have a member organization that's joining a hospital system. And that is a good thing, we hope. And we hope those hospitals, which are undergoing their own just enormous change, including being penalized for readmissions, will be able to embrace and take on the responsibility for people with serious mental illnesses and addictions. And of course, here in Connecticut, your own governor has announced cuts. The cuts this year, I understand, are nothing compared to the plans for next year. And I would urge you, on behalf of people with serious mental illnesses and addictions, to really help him understand that this is not the place or the time to ratchet down.